COVID-19 hits the vulnerable members of our community especially hard. And if you're homeless, staying away from large groups or going into self-isolation can be impossible. News 4's Juliana Valencia is live outside a shelter in Northwest D.C. Juliana, have there been any confirmed cases of coronavirus at our shelters?
Well, Doreen, the CEO at Central Union Mission, he's grateful because so far there have not been any confirmed cases of coronavirus here or at other shelters in the district. But that could change. There are about 6,500 people without homes in D.C. That means there's thousands of people without basic access to hygiene or hand washing. That's why it's so important to have shelters like this one stay open.
With nowhere permanent to go, people without a home can be even more vulnerable in getting and spreading coronavirus.
The folks that we serve tend to have chronic health issues, weakened immune systems, so we're doing everything we can to try to prevent the spread of the virus.
Joe Matamano is the CEO of Central Union Mission, a place providing D.C. homeless with a warm meal and a clean bed. 2 weeks ago, they started cleaning the building more and encouraging frequent hand washing.
We're sanitizing hand surfaces multiple times a day, whether it's handrails, doorknobs, fixtures. We're doing all of that. But on top of that, we are routinely checking the body temperature of our guests at check-in every day. If they have symptoms, we're sending them out for a health evaluation. The same thing for our staff.
His worry is for those who can't go inside because of a fever.
We're not able to let them stay here because they may spread the virus to others. What's the next step? Our hope and prayer is that the city is preparing for that.
Central Union Mission is trying to keep things running as normal despite some changes. They're not allowing volunteers, and Matamano says they're already seeing a dramatic decline of donations in money and food.
All three of those resources are critical for us, and so that could make our job very difficult to do in the weeks and months ahead. So the longer this goes on, the more we're going to be stretched.
Now, if you want to help out with financial donations, you can go to missiondc.org. And I reached out to the Department of Human Services, and they tell me for people that are turned away from here because of a fever, they're working on a plan so that when they're tested for the coronavirus, they can wait in an isolated area while they wait on those results. Jim, Doreen?
That's good to know. All right, Juliana, thanks so much.